So in our previous video, we talked about our sit bones or ischiotuberosities and how our sitting posture can affect potential pain there. And so I wanted to get into a little bit more. As I mentioned, without going crazy on anatomy, we've got a lot of bony structures here, right? Bony structures, hamstrings attach here, quads and hip flexors attach here. Psoas comes down through and attaches on the inside of our femur bone that attaches to the hip socket here. And so we've got a lot of muscular attachments from our top half of our body into the bottom half of our body. And because we're asymmetrical beings who have a dominant side, there can be a lot of tug-of-war that goes on front to back, left to right. And so we talk a lot in our practice here about symmetry and the need for good pliability. Obviously, for women, during our cycle and or during pregnancy, we get those surges of relaxin and estrogen. And so that can sometimes contribute to a little bit more of the shifting and or laxity. Talks a lot about and contributes a lot to sacral pain. We've got a bunch of videos and content about that too. It's because some of that shifting can happen here. But specifically to the sit bones, when we talk about that shock absorber function, when we sit, we don't want that to get stiff and rigid. The pelvic floor muscles inside, this is just the inner layer, but then also our glutes and everything, our bodies do an amazing job of trying to compensate. If we've got pain somewhere, you get a slight hamstring tweak, you have a bit of a pelvic rotation or asymmetry, the body tries to compensate. But a lot of times if there's that tightness or guarding, instead of being a shock absorber, it makes this like a rigid brick we're sitting on. And when patients come in or call, they'll discuss or bring up a complaint of, it feels like I'm sitting on a block, or it feels like I have a stick in my hip bone. And so we want to restore that pliability and allow that shock absorber function to occur. So just because you're pregnant, or just because you're in your cycle, or just because that you have some tension doesn't mean that you need to suffer with sitting bone pain. We can help, and we'll talk about more of that in the next video.